If you have a rotation in the pelvis, the hip socket will either move up or down, and that can cause the leg to appear to be longer or shorter. If it's functional, where you have soft tissue and muscles holding the pelvis out of alignment, that could cause the discrepancy. You go behind this, the ear to feel the bump. You drop down and you run your fingers across the tendon, and then maintaining contact with the tendon, you roll in front of it and you press in, and you'll come in contact with this first cervical vertebra. So to find the first cervical vertebra, I'm going to feel behind the ear. There's a bump right behind the ear here called the mastoid process. So I'm going to palpate or feel that bump to exaggerate what the body's doing comfortably or what feels good to the body. Your pressure on the finger here should be just below the level of the shirt. You should be in the skin, but definitely not pressing deep into the muscle here. It's the responsibility of your partner to let you know that what you're doing is uncomfortable. Finding the combination of movements that spirals into the spot here and releases the tension on this, in the area that I'm palpating here. So I'm going to push up on the heel, and I'm going to compress into the ankle from below and from above. What this does is it rotates all the vertebrae in the low back and allows all the muscles that are holding the tension to let go of the tension. And then slide it over towards my finger. And then add compression onto the sacrum. I'm going to hold this position for about half a minute or so. And I'm monitoring his breath and any other signs of a release that might be appropriate here. There's a deep breath right there. Sometimes you feel twitches underneath your finger in the muscles. You may even feel twitches underneath your hand and the shoulder. And sometimes there's releases going on. There's one in his neck that you're not even aware of, but they may be experiencing some profound releases inside of themselves. Visualizations, images. Stay connected with my partner here. And when I feel that we've reached a point where we can move on, I'm going to give a slight movement into the joint because I've been tractioning away, and then bring the arm down to the side and give some movement in. So when you engage the self-correcting reflexes of the body, and you never really know for sure when you're going to tap into them, just to let the body have its own process. And all you need to do is be present. If I was doing a whole session with Jeremy, I could leave his head in this position, and then I could move down and work on his shoulder or his hip or his knee or his foot, and just let his body remain in this position and let it continue to process.